Hello, I'm Vanessa Harvey, and I will be conducting an interview over the chronic illness COPD. Will you state your name for the camera?
Malin Perry.
Miss Perry, I'm going to be asking you several questions. I want you to feel relaxed and feel free to answer as you wish. I don't want you to feel pressured or uncomfortable, so don't be afraid to tell me if you don't know an answer or prefer not to answer a question I have for you. Are you ready to begin?
Yes.
Okay, let's get started. I will be covering several topics. The first topic I would like to discuss is pathophysiology. That's a big word that covers what a disease is. Explain to me, if you don't mind, what COPD is to you.
It's just a difficulty of breathing.
Okay. Did you know the disease may worsen over time?
No.
Do you feel you get less air in and out of your lungs than you used to?
I haven't noticed it if I do.
Okay. Do you feel your lungs may have lost some elasticity?
I can't tell.
Okay. When did you start to notice you had respiratory breathing problems?
It was around, I think, 2002.
Okay. What did you think led to your chronic condition?
Like twice a year I have I have trouble breathing. In late May and in December I have pain when I breathe.
Okay. How old were you when you were first diagnosed?
I guess my early 40s.
Okay. How does the diagnosis of COPD make you feel?
It's frustrating when I can't breathe.
Being diagnosed with COPD includes several risk factors. What do you think led to your chronic condition?
I assume it was allergies.
Have you ever smoked?
No.
Did you ever live with someone who smoked?
Yes.
Did they smoke in the home?
Yes.
What was the total number of years you ingested secondhand smoke in your home?
30.
Have you ever lived in a home heated with wood heat?
Yes.
Was the wood stove indoors?
Yes.
Did you ever cook on a wood cook stove?
Yes.
How many years would you say you were exposed to indoor wood heat?
Over 50.
You said 50? Okay. What symptoms do you have with COPD?
It hurts when I breathe to the point that I can't talk or I can't do anything.
Do you have recurrent wheezing?
At those times when it hurts to breathe.
Do you sometimes feel like there's a rattle in your chest?
Yes.
How would you describe your cough?
It's deep and usually there's always congestion. And I cough when there's a pain on breathing. It'll make me cough. It's like a involuntary action or something.
Is your cough productive?
Yes.
Do you feel short of breath often?
Just those 2 times in the year.
Tell me more about your shortness of breath. What makes it worse? Those seasons?
Yes.
Okay. What relieves it?
The inhaler.
Okay.
Singular, I take that year round though. And when it really acts up, I take a round of steroids.
So you said there's a time of year that's better and worse. Is there a certain temperature that it correlates with those seasons?
The wet, cool, wet. The spring when it's warm and wet. If it's hot and dry or cold and dry, I breathe better.
Okay. Have you had any specific medical tests done with your COPD? Like a chest x-ray?
No chest x-ray. I have had a CAT scan, but not for the asthma. But
Okay.
something else.
Do you see a family nurse practitioner or a doctor?
Nurse practitioner.
Does she mainly treat your with non-invasive measures like medicine?
Yes.
Okay. How has your life changed with COPD?
Well, when those times happen, I can't sing. But I'm used to it. I don't let it keep me from doing and going somewhere.
Okay. What changes have you had to make because of your difficulty breathing?
I don't know what you mean.
Do you feel like it's limited you in a lot of ways or any ways?
I don't see it that way.
Okay. Do you live with someone who smokes in the home anymore? Do you heat with wood heat in your home now?
No.
Do you get upper respiratory infections as often since those changes have been made?
I don't know that that makes any difference, the wood heat, because I lived in a home recently, 4 or 5 years ago, and I didn't have wood heat, and I had a horrible flare-up, bronchitis, and was diagnosed with walking pneumonia.
Was that, I'm sorry to interrupt you.
I mean, I feel like it was because I wasn't taking Singular year-round, or I wasn't taking the inhaler like I should, or any steroids.
Was that during one of those times of the year that was worse?
Mm-hmm.
Okay. What would you say not living with a smoker or not having wood heat any longer, would you say that's made any difference?
I assume it has.
Okay. What have you done to promote your health?
Well, I mean, I take Singular year-round
Daily?
now, yes.
Okay.
And when I feel the pain coming on, if it persists more than 3 or 4 days, I call and get a round of steroids.
Okay.
And I use the inhaler when the pain is when I breathe.
Do you see your FNP regularly, your nurse practitioner?
Yes, twice a year.
Okay. Do you take your medicine regularly?
Yes.
What do you try to do and prevent the flare-up? You said you take the steroids and the inhaler. Anything else?
No.
Okay. Do you try and avoid crowds when you're not feeling well, or stay home from church?
It does sometimes when the congestion's bad, but no, as a whole, no.
Okay. Do you feel your illness is managed well?
Yes.
Okay. What would you change, if anything, about your health regimen to better manage COPD?
I'd like to see a asthma doctor. I think they're called pulmonologist. I've seen one time, but I can't afford to see him on a regular basis.
Okay. So you've told me you take a rescue inhaler, and you take Singular, and you do steroids occasionally, and you've had antibiotics for pneumonia. Do you take any other medications?
No.
Okay. Do you wear oxygen?
No.
Do you wear a CPAP or a BiPAP at night to sleep?
No.
Do you use a rescue inhaler often?
No, just when it hurts to breathe.
When it's those times, how often would you say you use the inhaler?
I don't want to use it no more than once every 4 hours.
What happens if you take it more than every 4 hours?
I get very jittery.
Okay. Does it make you, you feel like you just can't focus and
I feel like I need to eat.
too shaky?
Yes.
Okay. Do you feel like your medications are adequate?
Yes.
Do you feel you need any more or any less?
Well, I don't know if there is anything else.
Okay. Do you feel like there's any barriers to receiving the treatment you need to feel your best with COPD?
Yes. My deductible, I have a $4,000 deductible. I can't afford to go see Dr. Galley, the one I saw before.
Okay. Do you feel like you've been educated properly on your illness?
Probably. I'm educated myself.
Okay. Are you able to afford, if you got a referral, so you're saying that there's no way to meet your deductible? Has your nurse practitioner offered you any assistance?
Yeah. I mean, she's offered me to go see Dr. Galley again, but no assistance.
Okay, so you wouldn't qualify for like a program to get help. Okay. What would you say is a complication of COPD?
Not being able to breathe, the pain.
Okay. Have you ever been hospitalized due to a flare-up?
No.
Is the coughing and shortness of breath cause you to lose sleep at night?
Not that I know of.
Okay. Describe for me what it feels like to be down with COPD and not be able to go do the things when your illness bothers you.
Well, I don't know that it stops me from doing anything. I'm used to it.
Okay.
I just can't sing. I can't talk a lot. Sometimes it's impossible to even talk. Say 1 word or 2 words without a pain and a cough.
And you do that for a living?
Mm-hmm.
Have you ever missed work because of it?
Yes, once in a great while. Not a lot.
Okay. Do you have benefits that allow you to take time off work?
Mm-hmm.
Okay. Do you feel like you sit out on certain things because you may become short of breath?
Yes, singing, conversation.
Okay. How has this illness experience been for you?
It's frustrating. It makes me mad when not angry, but it's just like, why can't I breathe? Why can't I talk?
Is it irritating?
Yes.
Tell me about a time when you were the sickest you've ever been with COPD.
Well, it was about 4 or 5 years ago. My youngest daughter took me to the doctor. I was running high fever and I was coughing up a dark green congestion type stuff. And even the nurse practitioner had a worried look on her face. And but that was before I started like always making sure I had a steroid. If I go to hurting, it's like I've learned how to keep that from getting that bad.
Okay, you've learned how to manage, and it sounds like you've become adjusted with your life. How did that make you feel?
Well, I was, frustrated that just a cough or not being able to breathe would make me so sick.
Right. Tell me more about your quality of life. Are you independent? Do you live alone? Would you say you have a full life?
Yes.
Tell me about that.
Well, I have church and I teach at night and I have a day job where I'm the head trainer and I'm very involved in church and my family and my grandkids.
Okay. Do you enjoy hobbies?
Oh, yes.
Tell me some of your hobbies.
I like to cross stitch and crochet and sew and do crafts and garden.
Do you ever have to sit out on a hobby or not? Are you not able to do a hobby because of your COPD?
Not that I know of. I just can't. I can't participate in music like I'd like to sometimes.
Okay. Do you volunteer?
Yes, at my church. I play the piano for the church, and we go to the nursing home once a month.
Does your COPD affect your piano playing?
I don't think it shows, but there are times when I'm coughing and I'm playing because it takes energy to play the piano, and it's hard to breathe.
Okay. Do you feel as though you have adequate resources to manage your COPD?
I don't know what adequate as far as I think there would be more if I could afford it.
Right.
But I think I do okay.
Do you feel like your insurance is adequate?
I think it's adequate. I wish I didn't have such a high deductible, but that gives me a lower premium.
When do you qualify for Medicare?
6 years.
6 years is a long time to wait. Do you feel like you have good support, like socially?
Yes.
Do you have a strong family support?
Yes.
Tell me about your family support.
I have 2 daughters that would let me stay with them if I needed to. And they would help me get to the doctor.
How about your emotional support? Do you feel like your church family supports you?
Yes.
And you have a lot of friends?
Yes.
Good. Well, Ms. Perry, that concludes the interview. I want to thank you so much for allowing me to interview you over your chronic illness.
It's my pleasure.
Thank you.